Because if something is not working somewhere, you need to tell us so that we are able to rectify. Today, I basically thought that it would be important now that this is cervical cancer awareness month. And cancer has become a really serious disease that is taking a lot of our people. And it is important that we get to know what really the government is doing, and equally to talk to the members of public. What can you do before you also get into this? First and foremost, our ministry, the Ministry of Health, envisions a nation that is free from preventable burden of cancer. And let me just extend this a little. It is not just about cancer. Any preventable disease, we are looking forward. We have a vision to see that everybody, we can be able to take care of diseases that are preventable at the society level. And this is as outlined in the National Cancer Control Strategy of 2023 to 2027. This vision aligns with the Kenya's constitution, which guarantees every Kenyan the right to have quality health care, and the bottom-up economic transformation agenda, which emphasizes cancer prevention, primary health care, and digitization of cancer services. As you may very well know, the Ministry of Health, or the government of Kenya rather, has enacted 4 laws. That is the Primary Health Care Act of 2023, the Digital Health Act of 2023, the Social Health Insurance Act of 2023, and equally the Facility Improvement Financing Act of 2023. So all these things that we are doing are in line with the Constitution of Kenya, the bottom-up economic transformation agenda, and the emphasis on the laws that we have in the country. Ladies and gentlemen, why is cervical cancer a priority, and what progress has been made in addressing it? First and foremost, cervical cancer is the leading cause of cancer mortality in Kenya, with 5,845 new cases and 3,591 deaths annually. So every year we have women who get cancer, 5,000 of them. More than 5,000, almost 6,000, because it's 5,845. And we have more than 3,000 women who die out of cervical cancer annually. And to address this, the Ministry of Health has trained over 12,500 health workers in cervical cancer screening and treatment of the precancerous lesions, integrated with the breast cancer early detection, because it is very important for early detection. When it is detected early, then we are able to take care of it and somebody can get treated. We have been able to equip 47, all the facilities in all the 47 counties to treat the precancerous lesions, and developed and distributed information, education materials, and communication materials to raise awareness, because we need to we need to talk about this every now and then. We need to tell people what they need to do. We need to equally educate each other in every place that we are at. What targets have we adopted under the WHO's global strategy for cervical cancer? So Kenya is committed to achieving the 2030 targets of the WHO global strategy, which includes vaccination, 90% of girls at the age of 15 years and below, screening of 70% of the women aged between 25 years and 49 years, ensuring that these 90% of women with cervical cancer who receive treatment of the same. So this is very, very important. And for Kenya, the progress has been steady, with national cervical cancer screening rates increasing from 11.1% in 2018 and 2019 to 38% in 2022, 2023. We will give you the data for 2024, 2025 later. And with the government addressing the challenges in HPV vaccination coverage, we have been conducting a lot of community outreach and sensitization campaigns. Remember, this comes with a lot of myths. It comes with a lot of, cultural shocks. So it is important to keep conducting community outreaches, train healthcare providers, and also strengthen the school-based vaccination programs. Ladies and gentlemen, this is Cervical Cancer Awareness Month. I'm calling upon all the ladies in this country. Please go and get screened, go and get checked, go and if their diagnosis that has been done or it's confirmed, please try and get treated so that we can get into these targets that have been set by WHO, and also as a country we can improve in terms of vaccination, in terms of screening, and also in terms of treatment. Of importance is to ensure that we do not lose anybody through cervical cancer anymore. I want to move into the emerging issues. But before that, I also need to mention that in financing the fight against cancer, cancer screening has been included in the primary healthcare fund. The PHC, which is going to take care of the lowest level of facilities, that is the level 2 and level 3. Equally, in the social health insurance fund, oncology packages will ensure a comprehensive coverage, and equally in the enhanced care and infrastructure and in the enhanced care fund, which will address the costs that exceed the existing packages. It is important to note that we have the three funds, that is the primary healthcare fund, the social health insurance funds, the emergency, critical, and chronic illness fund that can take care of these issues. I want to move ahead into the emerging issues in society, which we have been able to see in the last few days. And it is important is Mpox as an outbreak in the country on the 31st of July 2024. That is last year. And this was following a confirmation that had already been done. Already since then, since last year, we have confirmed 31 cases of Mpox in the country. And this is across 12 counties. We have also had 29 of these cases have fully recovered. One is under home-based isolation care as we are talking, and we reported one death in 2024. Our surveillance systems have been on high alert with contact tracing, because should we encounter a case, a confirmed case, because there is a difference between samples and a confirmed case. Samples are what is collected from the people and taken to the lab for confirmation. Therefore, out of the confirmed cases, we have to do contact tracing, get to know where that person passed through, who did they talk to, who were they seated with, did they get into body contact with the person, and also test them for just for confirmation, or to ensure that we do not have people who are at risk in the community. So a total of 225 contacts have been listed, and 212 have been followed up in the last 21 days. So it is basically just this month. 9 contacts out of those who have been followed have tested positive again for Mpox, and 8 are still on follow-up in case they develop any symptoms of Mpox. 13,617 travelers have been screened at the ports of entry. When I talk about ports of entry, I'm talking about places like Jomo Kenyatta, that is air port of entry. We have the land and sea, areas like Malaba, border, you know. We also have Kilindini Harbour. Therefore, these ports of entry, we have screened 13,000, and culminatively, 2,934,759 travelers have been screened in these ports of entry. Laboratory testing, we have our national public health labs that has received 377 samples already, and 31 out of this, that is where we have 31 that tested positive, and 343 have tested negative. 3 are still pending. So we still have them in the lab, and we want to confirm whether indeed they have Mpox or it could be any other disease. We are ensuring that we have messages going to the public, and this is just one of the ways of getting to you people and telling you that yes, indeed there is Mpox in the country. If you want to know somebody who you can suspect someone has Mpox by seeing the skin rash, fever, they have headache, they have muscle aches, they have back pain, they have fatigue, you know, you just feel low energy, that you're at work but you're really having low energy, swollen lymph nodes, and equally and these symptoms last between 2 to 4 weeks. Therefore, we ask members of the public to observe preventive measures out of this, that we are able to see. Maybe make sure you stay informed about the risks of the transmission. For instance, if you have sexual relation with a person who is suspected to have Mpox because of the body contact, then you may equally get Mpox. If you get into contact, like greeting people or sharing clothes, then you may get into contact with the infected with Mpox. It is important to adhere to personal hygiene practices, the best hygiene practices, regular hand washing with soap and water, using alcohol-based sanitizers. I've said you avoid sharing items, safe handling of animals and animal meat. So avoid contact with wild animals like bats, monkeys, squirrels, and consuming bushmeat, which is not even inspected, because such animals harbor certain viruses and could cause disease outbreaks, especially in regions where the diseases are more common. Therefore, I want us to stay on alert. But before we could even close on Mpox, then something started flaring in the air, and everybody was talking about the human metapneumovirus in Kenya. But we had just seen in the news about this virus in China and all that. This is not a new virus at all, but it has been in circulation globally since it was first detected in Netherlands in 2001. In Kenya, the human pneumovirus has been documented, and it's circulating pathogen contributing to respiratory illnesses, and particularly in children under 5 years of age and those that are immune compromised individuals. Therefore, surveillance data from Sentinel sites in Nairobi, Kisumu, and Kilifi have highlighted the roles in hospitals admission for pneumonia and other respiratory illnesses. Therefore, the data from the surveillance sites has not shown any indication of any unusual increase in the number of cases of respiratory illnesses caused by the virus. That is the only time we can declare that there's an outbreak or there is a funny disease that is in the country. But data is not showing that there's an increase of these respiratory diseases in the country. So there is no cause for alarm. And this is from the Ministry of Health. We have enhanced surveillance for all respiratory illnesses in the country. When you go to hospital, you have a cough or something, then you have to be screened further to just ensure that we do not have this disease in our country. Please do not worry. Do not worry at all, because Kenya routinely monitors respiratory pathogens through the influenza sentinel surveillance. And we are able to tell and detect some of these issues from the system. So far, there are no reported cases of patients presenting with the respiratory symptoms in the facilities, whether in the level 6 facilities or at the county level. However, should there be an upsurge in the country, we also have capacity in terms of testing a wide range of respiratory viruses, including the human pneumovirus, metapneumovirus, and we want to assure that the members of the public, we will keep improving on the capacity to ensure that should there be an upsurge, we are able to contain it in our country. The influenza center and research institutions like such as KEMRI, they also exist, and the capacities that were established during COVID-19. Remember, during COVID-19 pandemic, we had a lot of structures built, and equally structures that were established. They are still in existence, and we may have to rekindle that so that we are able to enhance on the capacities. I want to bring to your attention on Marburg virus disease that we've seen equally in the media. And I want to say that Marburg is quite a serious disease with mortality of up to 70%. This has been, we have received an alert from WHO of a suspected Marburg outbreak in Tanzania, not in Kenya. This is yet to be confirmed. So let us not talk too much out there in the media. Let us not create fear to our members of public, because we have not had any case in our country. The symptoms of this disease is abrupt onset of high fever, severe headache, and severe malaise, commonly associated with muscle aches and pains. There is severe watery diarrhea, abdominal pain and cramping, nausea and vomiting may follow shortly, with the diarrhea persisting for a week. Many patients develop severe bleeding manifestation between 5 to 7 days, and fatal cases usually have some form of bleeding, often from multiple areas. So there is currently no specific treatment or vaccines approved for this disease. And Marburg spreads through human-to-human transmission via direct contact through broken skin or mucous membranes with the blood, secretions, organs, or other bodily fluids of infected people, and with surfaces and materials, e.g. bedding and clothing, contaminated with the fluids. So to prevent ourselves from this, we need to protect ourselves through avoiding contact with suspected cases and other public measures such as hand washing. Our surveillance system has been heightened at the ports of entry and countrywide to detect any potential cases. We are going to do whatever possible to protect this country on public health risks and emerging issues in society that may cause a lot of panic and a lot of misery to our people. So I want to ask the members of public to also stay on alert. Just ensure that you practice high levels of hygiene around yourself, around your homes, around your workplaces, just to steer away from preventable diseases that may occur. Most of the diseases, illnesses that we see in our society, they are preventable. When we talk about vector-borne diseases like malaria, diseases, waterborne diseases like cholera, foodborne diseases, again, all these are preventable. Diarrhea, Therefore, it is very important. It is very, very important as ourselves. We take care of ourselves. We take care of our spaces. We take care of the areas that we work. Our children, when they go out to play, when they come back, let them clean their hands with soap and water. Sorry, I got distracted. Somebody is asking a question. Yes. So that these diseases, we can prevent them at the bottom of the pyramid. We have our community health promoters. We have kitted them. We have trained them. They are going around the communities, equally spreading this gospel. Become our source of truth equally, that you're able to spread this gospel, or to talk to the people and tell them why personal hygiene, environmental hygiene, water and sanitation are the 3 key areas that we must focus on this this year. I want to end by saying that our Epuka Uchafu Afya Nyumbani initiative will galvanize communities to actively participate in cleanup drives, waste management, and environmental conservation. And through this initiative, we will work very closely with our counties to promote proper waste disposal, facilitate best practices for sanitation and household, construction of sanitary facilities, and as well as strengthen good hygiene practices. It is important to note that this will reduce the prevalence of many, many diseases, particularly the waterborne diseases outbreaks, and improve public health outcomes. And this is in line with the government's agenda on universal health coverage, on preventive and promotive health. We will also empower community health promoters to spread these messages at the community level. Ladies and gentlemen, I want to say thank you. I'm looking forward to a really, really good year. The best that we can ever make out of this year. And remember to spread love, kindness, and humility. Patience is the key. The key. Mambo ni matatu: prevent, promote, and protect. Have a great day.